that.
Yes, I ordered some pandemic supplies, much to annoy Kitty, because there's some things I felt I needed, and I will go through them. And there's also a bonus little feature. First I have to let Becky back in. Well, that was a great introduction. Now, of course, what I do recommend is the N95, and everybody's recommending the N95, and they're getting very hard to get, and I imagine they're going to get a lot harder to get, both for healthcare workers and everybody else. So, it's important. These are going to get reused, I think, if we have a major pandemic. I don't see any way out of that. I really don't. And that begs the question, so what? So why did I buy all this junk, right? These aren't the greatest swim goggles, they are Speedo, but the reviews aren't great. The anti-fog comes off. What they do is they seal very tightly over the eyes. So I'll be carrying one of these at work, and Kitty's going to be carrying one at work. And the idea being that if she has to put an airway tube into somebody who's got coronavirus or probably has coronavirus, our hospital right now is claiming that it's just droplet, not airborne ever, which is absolute nonsense. When you intubate somebody, even if it is droplet, it's going to go airborne. Everybody knows that. And they're saying that face shields are fine and the thick gowns are fine. Well, that's maybe good for the people who aren't doing it, who are coming up with these ideas, but I really would prefer it if they had plastic HEPA hood sealed units on, I really do, for that type of invasive airway interference, but no. So we're doing what we can to protect ourselves. I know it's going to look a bit weird for Kitty to do this. I think it's a good idea. It's a little bit of extra protection. Anything airborne that gets into the eyeball doesn't get into the eyeball, it goes on these. And these are going to go into a plastic bag and then be washed out with hot water and then cleaned by sunlight. So I got 3 each. I do think if you're walking around town and you're not actually shopping, you don't need this sort of level of protection. I'll just keep your distance. But if you're going shopping or you're going on transit and there is fulminant pandemic in the area that is airborne, or you suspect is airborne, a sealed goggle is the best thing to do. Most of the cheap plastic goggles will help a lot, but a lot of them aren't sealed. So you have to make sure they don't fog. I've got a few of these, right? So you'll see people doing this sort of thing. No, you really want to do this sort of thing. The problem is it's not a sealed unit and it will actually cause fogging of the glasses. So one of the things this does is it's a layer of protection. Now I wouldn't go over just this into an area. I would have a surgical mask underneath this or another bandana underneath this, and it's going to get uncomfortable quite fast. Don't use tape because you'll rip it off, but when you take these off, gentle. Right, gentle. Drop into a bucket with weak or strong bleach solution depending on your preference. Leave it there for 12 hours or so, or 24 hours, preferably stirring it quite often, but not that often, and then putting it in a washing machine and doing it. Now, one of the amusing things online is everybody telling people to buy food, right? Yeah, if you're a prepper you would have food. You'd have at least 14 days, I would imagine. Most people in their home should have 3 days. Most people, in fact, I would argue, have 3 days worth of food in their home. They just don't know how to cook it or don't want to eat it, or it's old. But boosting up your own pantry of stuff, if you use tins at all, make sure you've got 10 of them or 12 of them or 5 of them, not just one of them. That sort of thing's a good idea. But I actually ordered another one of these because it's from the manufacturer where I was getting the stuff from, and I just bunged one of these into it. I didn't, you'll note, order 300 of them. I ordered one because I have plenty of food floating around, and I'm not yet in stage 4 of my pandemic plan, so I'm not yet increasing the amount of food in the house or the water supply because I don't see a need for it. So as of February 13th, people are catching up. We now have a revised screening assessment tool. So for COVID-19, China, of course, Hong Kong, Japan, Macau, Malaysia, South Korea, Singapore, Taiwan and Thailand have been added to the list. Of course, there's about 3 other things we're actually actively screening for, in addition to normal flu and normal C. diff and normal VRE and all that stuff. So the additional stuff we're screening for is also on this sheet, and it's somewhat interesting. You should be aware of the fact that dealing with a major SHTF, for example, if this becomes pandemic status in North America or the Europe, or the United Kingdom, if it's pandemic there, you know, there's tens of thousands of cases, there's runs on everything, and it's problematic. Don't forget, because you're a prepper, there might be other issues going on as well. So you do want to keep an eye on the other issues whilst not being distracted from mitigating and avoiding the main ill effects from the actual major SHTF. So what we have right now is we have viral hemorrhagic fever, which used to be called Ebola. So Democratic Republic of Congo has Ebola, Nigeria has Lassa, and Sierra Leone has Lassa. Now there is some discussion about Nigeria having a new infection, but I haven't found anything on that recently, but it was discounted as Lassa at one point. They're also worried about a whole bunch of other African countries and they're the symptoms, and we can't do much about it. MERS coronavirus is actually in Saudi Arabia still, and there's the other areas that we're concerned about it, in the Middle East mainly. That's a very high death rate, you don't want to get that. Avian flu, China, etc. But coronavirus, novel coronavirus, COVID-19 is what we're going to be focusing on. So one of the things I hear all the time online is more people die from flu, and this is absolutely true. But the percentage who die from flu compared to the number who get flu is very, 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 very small. And it really is usually the very young and the old, though not always, who die from flu. It's very rare that somebody will die from flu who's reasonably healthy. This is different. COVID-19 is different because it has approximately a 200 or even higher % times ability to kill you if you get it. So that's the major difference here. It's much more likely to kill if you get it than normal influenza is. It's also spreading again, like SARS did in 2002 and 2003, to nursing, hospital, respiratory, portering, catering, cleaning staff, visitors, other patients inside the hospitals. But unlike SARS, this appears to not locate itself within hospitals. One of the interesting things for me is going to see if we actually do get caseloads locating in urban centres in the West inside of hospitals. I'm actually thinking we're not going to. I think it will be a community issue. How bad it will be in the community, I think a sensible person would look at Wuhan, China, and assume that we will end up there, unless we get lucky. I think a sensible person wouldn't look at this and think we're going to get far worse than Wuhan, China, but it's not sensible to look at this and say it's droplet, we can contain it, it won't be in our community because we're special. We're special in Canada, our public health is amazing. It is, Monday through Friday, not really there at night, certainly not really there at weekends, and certainly the messaging from all governments on quarantining has been confusing, and the reluctance to just shut down an entire city because you have 2 or 3 cases that you know of exposed population on the off chance that 14, 21, 28 days later you hold that outbreak onto that city and they haven't allowed people to leave isn't going to happen. So this is like general flu. It's going to be about as able to protect community spread as general flu. Maybe it's going to be more infectious, maybe less infectious, maybe the same. Nobody actually knows at the moment. So just some cool graphics for you. Don't go to any of these places on holiday or for work if they're bright red. Really consider not going if they're orange and or pink, I guess, pinky orange, and green safe to go. I wouldn't go. I wouldn't travel. There's MERS coronavirus and avian flu. That's where it is right now. You can see that where it is and the higher risk of it from the different areas. Poor China's getting absolutely pounded, isn't it? So there's still confusion about N95 masks or just basic surgical masks. And I'll put up what the hospital is saying, Ministry of Health is saying, on the 13th of February in Canada. And I'll discuss what they're saying a little bit in detail while you're looking at it. So what they're saying is basically straightforward. They're saying you don't need a mask. You can just use a mask with a face shield. And I don't have any because they're not actually N95. And I might get some for generalised walking around the streets if I think I need to, but right now I don't. And I am concerned that this is the messaging being given to nursing and respiratory staff. The World Health Organization, according to Canada, has confirmed it is only droplet and contact, which is good, so it means it won't spread very easily, and that you don't need an N95 unless you are dealing with a critically ill patient, patients who've got airways or are coughing a lot, or are taking inhalers, or whatever. And this is where it gets fun. However, guidelines issued by Ontario's Ministry of Health still include the use of N95 respirators for non-critically ill patients, should be patients, an additional requirement that's resulted in high demand for N95 respirators across the system and throughout the organisation. So you can see right there my hospital's looking forward, and it's looking forward to not having enough N95, so it's looking forward to convincing people they don't need to wear them. That's going to be a hard sell. For now, our hospital, I'll obscure that, continues to include N95s as part of PPE use for any personal investigation which is primarily happening in the emergency department, which it is. Clinics continue to have restricted access to N95 respirators and do not need them considering the mask integrated bag provides adequate protection. As a reminder, it is critically important to avoid stockpiling supplies and order only what you need. Absolutely. If I was a nurse or a respiratory therapist or a doctor working in a major teaching centre in an urban area, there is no way I would stockpile my own supply of N95s on the off chance the hospital wasn't able to provide them. After all, China's providing lots of masks to their staff, and they're also getting infected. And you can see the level of protection they're doing. What I'm interested to know is with the painter suits and the sealed masks and the goggles that the Chinese staff have been bravely wearing over the last 3 to 4 weeks, I want to know how many of them have been infected. And again, I will be doing the donning on, donning off video, and I'll mirror the hospital one, because it's really important that you take this stuff off and put it on properly, because it's really likely to give you an infection. For example, this, when I have this on, I wouldn't just use this, but if I've got nothing else, I'll use this and maybe a scarf or a silk scarf underneath it or whatever. I want barriers between me. It's not going to filter the viruses if they're airborne, but it's going to give me a measure of protection that I don't have without it. So when I take this off, if I take it off, I should have gloves on, right? The gloves go off first. I wash my hands carefully, hopefully with soap and water under running water, but if not, alcohol. And I rub and wash all the surfaces for 20 seconds. If I think I may have been contaminated, I'm going to let it dry, and then I'm going to do it again. And drying should be with a towel, a paper towel preferably, or a cotton towel that's single use, and then put into the bucket of bleach to be hot washed. Now when you take this off, without gloves, the gloves are off, my hands are sterile. So I'm going to go underneath and I'm going to curl, because all of this is infected. But what a lot of people will do while they're wearing stuff like this is touch themselves. Right? Hands off your body and surfaces. When you do this, you don't want to touch the outside. And you pull it off like this. What a lot of people will do, because they're not thinking, is they'll do this. So I might slow that down for you, but I'm sure you can see the difference. The outside of this is covered in sticky red jam, and you don't want the sticky red jam anywhere near you, ever. Well, that's it for this one. I hope you found some use for it. I did promise a myth, and I will give you the myth now. One of the things I have is a reasonable amount of low denomination cash notes for using specifically in SHTF when ATMs aren't working. What I'm hearing out of Singapore from people who've got family in Singapore is nobody's taking cash. The banks are all shut. Nobody who's selling anything what they have has any ability to store cash safely or to put it in the bank. So strangely enough, the old canard that in SHTF cash is king seems to be, at least in Hong Kong and Singapore, seems to be not true. What you need is a credit card or a debit card. So I know a lot of preppers out there are very suspicious of everything, including me. But you might want to, if you don't have one, get a credit card or a debit card solely for the purpose, if you don't have one already, of using it to buy stuff if Wuhan City, Singapore type fear and pandemic arrives in your town, because people are actually refusing to sell anything to people who have just got cash. They're also, of course, worried that the cash is contaminated, which is also a reasonable thought process that you should also be taking on board. Well, I hope you enjoyed this. I'm not saying I really am not enjoying doing these. I really want to get off onto something else, but I think it's time pressured, and I think it's important to get this stuff out there as it evolves, so that I find out from the Ministry of Health and the hospital, and as what I'm seeing and what I'm thinking. I think it's important, but it's really important not to spread fear, and it's really important not to spread opinion as fact. For example, the crematorium going night and day in Wuhan City. I have no independent reports of that from anybody who's actually speaking to anybody in Wuhan City. So it's just a load of garbage as far as I can tell. Same with sealing people in the apartment blocks. That's also not true. It really isn't. When you're looking at videos of things like that and people lying dead on the street, bearing in mind that what you're seeing is an edited, unfiltered example. SARS caused spread through sewage pipes in apartments. They evicted everybody and sealed the apartments solid so people wouldn't go back in there. to get their stuff. That's what they did in SARS, and I'm pretty sure from what I'm hearing that's what the Chinese are now doing in Wuhan City and other cities. So anybody that's hiding from the Chinese police and army and medical staff during an enforced evacuation, no questions, out of this contaminated apartment block, yeah, they're going to get sealed back in. They can go out through windows. They're not sealing people in to kill them or to hold them in place. Again, it's easy with a paranoid mindset to look at videos and go, whoa, what are they doing? What they're doing is they're trying to stop the spread of COVID-19 by any means possible. Remember what I keep telling you guys, the autonomy, the freedom of self ends in a pandemic situation. The only thing the authorities care about is their own safety and the safety of the greater good, the greater community. This is communism, and it will come to your streets and your town if this COVID-19 breaks out in the same levels that we have it breaking out in China. There is no reason why it won't. There's lots of reasons why it might not. So I don't really have a happy message for you guys. Brace, protect, prepare, plan, but act. Act now. Do stuff now. And if it's just getting goggles, get some goggles. Is it airborne? Maybe not. Why take the risk? Toodles. That was a Bad Terrier 2020 production. Good girl, Becky.